This one. Perfect. And one of the main reasons we do like to record these is to let folks be able to watch it. At least the information that is the core presentation and some of the main updates and such. If folks want to share and they don't want to be recorded, we can also turn it off, towards the end. I realize sharing your personal story, sometimes you don't necessarily want that out there for everyone else. All right, Johanny.
Yes, well, thank you.
Kick it off. Thank you.
We are going to get started to be respectful of everyone's time this morning. Super excited that y'all have been able to join us. As many of you might know, I am Johanny. I'm one of the ambassadors here in Florida, volunteer ambassadors in Florida. And we're excited to be with you all today to sort of kick off our Rare Disease Day, leading up to the national event that NORD's putting on Monday. So hope you all can join that 1:30 to 2:30 on Monday. And I have, of course, Fran, you want to do a brief introduction?
Hello, my name is Fran Hoken, and I'm the co-ambassador with Johanny here in Florida for NORD. As a volunteer, I'm a parent and a parent of 2 children, one of which has a rare disorder. And I especially saw the need for some emergency protocols and other things, that are kind of in her life early on in when we were, she came home and decided we need some stuff to change. And so that actually ended up bringing me to NORD and, affecting change for the whole community on a grander scale, and how we can do that through education and legislation and a couple other areas. So I'm here and I'm actually running the room as well. So I'm bouncing around a little bit, but I'll be here to share a few things. Greetings and welcome everyone.
Yes, and so I got involved after 2015. My son was diagnosed with adrenal leukodystrophy. I knew from day one I wanted to do something, and so dealt with his treatment. Unfortunately, he didn't survive and lost his battle to ALD. But I knew I wanted to do something, and so that brought me cross paths with NORD and been able to really work here in the state to try to help understand the challenges, concerns, and everything that our community is really going through or goes through. So excited to be with you all. I will say that please use the chat room. We are going to be monitoring any questions, concerns, or just sharing information or your story. Please use the chat room. This morning, Fran, next slide, please. We do, of course, want to make sure that we understand that NORD volunteers. Oh, sorry. Yes. We're volunteers and we're not medical providers, of course. So this is not a platform for medical advice. So please consult with a licensed physician in order to do that. We do have this morning a great event planned, a little bit of an update on the RDAC and what's happening since that legislation has been signed. We also do have, Fran, next slide. We do have, I don't think I have controls. We do have, and I wanted to share with y'all, of course, we want to thank our sponsors for all of our events for NORD, but we do have an update. There is a bill currently, want to make sure that everyone's aware that Senator Baxley has introduced to make Rare Disease Day official here in Florida. As you can see, there is Senate Bill 1116. We understand that that is going to be read on Monday, on Rare Disease Day. We just do not have the time when it will happen. So that is to be determined. And we will post information as we receive it or as we see it available on our social media pages for all of you to be able to participate. Of course, we would ask that if you're able to, that would be a great event to show up, right? For us to see the rare disease community come together. We're excited about that. And so with that in mind, I'll introduce Kelly. Kelly Rogers is joining us from a Maternal Child Health Care Administrator. She's also, of course, with the Rare Disorders, the RDAC, right? The Rare Disease Advisory Council. And Kelly, please share with us all the things that the RDAC is doing. Thank you for joining us today.
Hi, good morning from Tallahassee, Florida.
Hey.
Everyone putting in the chat, Neptune Beach, other areas. So it's nice to see you all. I've had the opportunity to talk to many of you. So for those that I have, it's nice to see you again. And those that I haven't, it's nice to meet you. So I'll tell you a little bit about myself. And then where we're at with Florida's RDAC. So a little bit about my background. I was on a very different trajectory in my professional career. And I had my son. My son was diagnosed at age 2.5 with autism spectrum disorder. And he had a different path for me, like many of you. And what I had very quickly began noticing and experiencing is that there were various systems of care that could support Clayton, my son, and our family. They weren't very clearly defined. I think those that administered those systems of care knew what they were, but how they were described to us, not having a clear understanding of our role. It took a couple of years to really understand the supports that he was receiving. And I thought, you know, we got to do better. So I started doing a lot of advocacy first in the Big Bend area of Florida and then statewide with the goal of advocacy and education and awareness. And then I, through that, had been meeting with various personnel and policymakers who asked me to join professionally the Part C of IDEA system here at the State Office and Department of Health. So that's Florida's early intervention program known as Early Steps. And I thought, what a great opportunity to really improve the system for families and to work with families and always bring that family perspective. So I just have to say, and I wanted to share that because on a personal level, I'm so encouraged and energized when we have families and individuals themselves impacted by rare diseases who are part of the change. So I thought when we here on my team were informed we were going to be coordinating this council, I thought, well, I know a lot about disabilities. So we got this. Let me just say, from working in the early intervention and disability field for 21 years, there's this population and the issues and the strategies and the barriers are very unique. And it's been eye-opening for me just from my background to dive into that and to learn that. So again, I'm really learning that from our partners, many including you all. So I just want to thank you for having the patience with us here in Florida. This is new to us. And I will say we don't have much figured out. We have more questions than when we started, and that's okay. And we welcome that. So a little bit about my team here. We are the Maternal and Child Health section in the Department of Health. I'm the administrator of that section. And our programs are for moms and babies. And this is important, and I want you all to know this because there was a conscious decision made by the Department of Health when this legislation passed that they wanted this council to have a little bit of space from our newborn screening program so that our activities were completely unbiased, completely not tied to any necessarily priorities and objectives of our newborn screening program, although they are very close partners. But they wanted fresh eyes and experience to this council. And though that is a little bit challenging for us, we are up for the challenge, and it has been an absolute eye-opening experience. So that's just a little bit about who I am and what our team does up here. So some of the things that we do is we oversee Florida's Healthy Start programs. We are responsible for Florida's maternal mortality reviews, all the fetal and infant mortality reviews that happen throughout the state. My team is responsible for. We oversee our Title V grant with HRSA, the Maternal and Child Health Block Grant. We oversee Florida's Healthy Babies initiatives in all 67 county health departments. And many other kind of maternal child health campaigns and promotions like Count the Kicks. We're developing a new maternal mortality campaign. And then we have 2 councils now. So we have the Rare Disease Advisory Council, and we also coordinate the Developmental Disabilities Advisory Council, which is also known as Bright Expectations, which promotes a website, a statewide website, where council members guide and assist us in determining what evidence-based resources and information should be put on this website for family members and individuals throughout the state with disabilities. So a little bit about what we do. So RDAC, as I mentioned, this is new. This just, next slide, please. This past legislative session, you all know, and many of you were part of the advocacy efforts to bring an RDAC here to Florida. I'm going to read this bullet, but then I'm going to go off the cuff a little bit, because the purpose of RDAC in the legislation is to assist us, the Department of Health, and really the state systems of care in providing recommendations to improve, I was just reading the comment. Thank you. In providing recommendations to improve health outcomes for individuals residing in the state who have a rare disease. So that's the legislative language. We really want to take a step back and say, where are the gaps? How can we improve the lives of individuals with rare diseases, including access to care, including supports, including research? So I will say we would have loved the opportunity once this legislation passed. Officially, Governor DeSantis enacted this statute on June 21 of 2021 last year. We would have loved the opportunity to really pull our members together and identify priorities, kind of establish some consistency with varying expertise on our council. We haven't had the opportunity, and I'm being just honest, with having the time and space to do that, as our first annual report is due July 1, which means it has to start routing in the department May 1. So we really had to jump into this annual report. And we're excited for that, but we're really excited for after this first annual report, when we can take a step back and really identify those goals, those broad goals with this council. And then I just want to mention Florida. I'm pretty sure what we could find were the 19th state to pass legislation regarding having an RDAC. So it's very helpful for us to look at what other RDACs have done. We've connected with NORD to learn more about that. Recognizing every state's different and priorities are different, but just learning from those who've been here before us has been so valuable to us. So our statute, next slide if you don't mind, our statute requires our RDAC to accomplish the following activities. So one is consult with experts. So that's what we do at every meeting. We have, and I'm going to talk a little bit in a minute about membership, but we have our council who has convened. We started end of September. to solicit their expertise. All meetings are open to the public, and I'm going to share that site in a moment. So consulting with experts on rare diseases and soliciting public comment to assist with developing those recommendations. So again, that's what we're doing via our public meetings. And we've also had some subcommittees that we found we needed to develop in order to develop our inaugural recommendations. We're also pulling in expertise. We've included NORD, our newborn screening program. We've brought in the director of Florida's emergency response to talk about what processes they have currently in place, and then how we as a council can be most impactful to ensure that there's components and support for individuals with rare diseases. And then it's also one of the functions of our council is to develop strategies for academic research institutions in Florida. So we can continue research on rare diseases. So that's one of the subcommittees that we've developed. We have a great group of geneticists and others on this group. And I'll have to tell you, if I'm being full disclosure, which I'm always pretty transparent, one of the things that we have noticed in our council is there's so much eagerness and there's so much work to do as we've had these subcommittees and as our council is kind of organically doing their work. We want to see things change right now. We want to put everything in this inaugural report with, you know, how we can fix the entire system of care in Florida. So what we've had to just remind ourselves is that this process is ongoing and that we will be doing this annually, and that we just in this inaugural report want to set the stage with where we're at. So this group, I will say, has some great ideas for, you know, really changing and having centers of excellence for academic institutions with rare diseases, and we'll get there, but we've had to kind of take a little bit steps back and say, here's what we can do this year. And I think what we've finally got to is we'll have these broad goals, and then each year talk about what recommendations and what activities we need to do to get to those larger goals. The second subcommittee, but one of the functions of RDAC, is developing recommended strategies for healthcare providers to be informed of how to be more efficient in the diagnosis and treatment of rare diseases. So that in itself, we can be a year solely and just talk about this. And we want to, and we keep doing that, but we have to keep bringing ourselves back a little bit. We have incredible advocates on our RDAC who have really helped identify some real gaps that you know, we here at the Department of Health would not have been aware of. So we are just allowing our participants to guide this work. And I'm excited to see where this subcommittee is going to go. They also have included recommended strategies for support and access to resources for caregivers and self-advocates with rare diseases. So we're excited to see that grow as well. And then our last subgroup is really, we're calling it our state agencies subgroup. And this is where we have leadership from varying state agencies. We also have advocates on this group to identify how the state agencies and the public supports that are provided through those agencies can improve services for individuals with rare diseases. So one of the first activities this subgroup has talked about, and I think you all will probably nod your heads and say, yeah, this is a real barrier we didn't know. We thought, well, let's just get the data real quick on data on individuals with rare diseases, and maybe look at, get those ICD-10 codes and then run them into different databases and the varying state agencies. So we first need to know, who are we serving in this varying systems of care? But we quickly realized that data was not something we can access at all. So we've had calls with National Institute of Health, who informed us about a project they're working on, and hopefully might be able to have some data by the end of 2022. Of course, we've learned about the data in Europe for individuals with rare diseases, but we have not been able to put you all just went away. I hope you're okay. I hope you can hear me. Am I okay? Yeah, okay, thank you. So we went from, let's analyze this data for, and identify who in these varying state agencies we're serving, to let's take again steps back to have some recommendations on identifying the data itself. So again, we're so excited. We just want to jump in, but I would encourage anyone who is implementing a new RDAP to give yourself that time and space to recognize this is a marathon, not a sprint. So reminders for us as a council of that have been very helpful. And then ultimately, the goal is that by July 1 of each year, we will submit a report to the governor and the state surgeon general here in the Department of Health that describes what we've done as a council and identify the recommendations that we are set forth in our legislation to identify. We've, as I mentioned, looked at many other states' annual reports. We kind of pulled some things that we think would be great in Florida, and I think we're doing some innovative things that I think some other states will be interested in how we are developing our annual report. So as I mentioned, we'll actually be, the RDAC will have the final version identified by the first week of March. I'm sorry, May. I think they have a meeting May 4th to finalize that report. And then, unfortunately, it takes a good 6 weeks to 2 months to route these kind of reports through the department. So I do anticipate some changes. I don't think significant to the actual recommendations, but just consistency and some things the department might like to see in the report. So that is where we are at. Membership. We questions. Okay. Our RDAC is has 20 members, is identified currently in statute. 10 members are appointed by the governor. 5 members are appointed by the Florida president of the Senate, and then 5 members by the Speaker of the Florida House of Representatives. We have agency heads, as I mentioned. We have geneticists. We have advocates. We have caregivers. We have representative from a biotech company. So we really have a diverse group that will only make our work richer. We do have some vacancies. We are full with membership currently for those appointed by the Senate and those appointed by the House, but we do have some vacancies. Each member is appointed for a 4-year term, and our current vacancies, they're on the next slide. We are missing an additional geneticist practicing in Florida. We're missing a registered nurse or an APRN who is licensed and practicing in Florida with experience in rare diseases. So we want to work with our council to identify possibly interested parties who can fill these, but we also want to work with you. If you all know of anyone, let us know. We can pass their name on to the governor appointments office, and we are happy to do that. We also are missing one hospital administrator from a hospital in the state, which provides care to individuals diagnosed with rare diseases. And then a representative of health insurance companies, which is critical to the work that we're doing. So again, if you know anyone, feel free to call me, email me. We'll get them engaged as quickly as we can. So as I mentioned, we started meeting the end of September. Our vision was initially was what, maybe they'll meet every other month or maybe quarterly. So especially right now, they have been meeting monthly and then 2 times a month in the last month and a half with these subcommittees. Everyone is so busy, but people keep showing up. There is huge excitement, commitment. We have had, we've been contacted by the media to talk about our DAC, and it's really exciting. And I know it's because of the work that you all are doing to really bring light to this. So we are really encouraged by that. And then, the RDAC will continue to meet. I want to let you know where we post information about our meetings. So if you don't mind showing the next slide, we have developed a website for our RDAC. I see this evolving. This is where we're at now. So you'll see on the left, membership, there's a meetings link and reports and publications. Some of those are blank. We're not quite there yet. But our meetings link will have all of our upcoming meetings. We ensure that any materials that we are going to share or discuss with the council is posted so the public has full access to those. We, as I mentioned, have public comment at each meeting. We haven't perfected it. I'll be honest, sometimes we'll have public comment and we'll budget maybe 10 minutes for that, and we have no public comment. And then we'll have other times where we have 10 or 15 minutes for public comment and we run out of time. So we're trying to really gauge, what the factors are that contribute to those varying levels of interest. But we really feel we are learning just as much from members of the public as we are our council members, and really identifying what their personal experiences are. That's how we become even more informed as a cohesive group. So please feel free to join these meetings. And then lastly, is a view of our meetings link. So you'll see how to join the meeting. Right now we're virtual. Click here to join the meeting. You don't see the meeting materials yet for these meetings because we're not there yet, but you can see past meetings and any materials that we've shared. Our next meeting is April 14th. We typically, let me see if she's put the time. Yes, 12 to 1:30. So we typically try to do this over lunch. It's just when our council is identified they're mostly available. So our next meeting is 12 to 1:30. Obviously, our legislative report, when it's finalized, will be on the DOH website. I started this conversation with you all saying we have more questions than we have answers. And we're okay with that. We're actually excited to work through those questions. Having this attention and focus for individuals with rare diseases in Florida has been, as you know, a real gap. And we're learning those gaps, learning the various real life implications for family members and individuals with rare diseases and how much we have to go as a state. But I want to thank all of you truly for helping us as we work on this here in Department of Health. I met a couple of weeks ago, maybe it's around a month ago, with the statewide biotech conference. And they wanted to learn more about our DAC. And at the end of the presentation, they were so gracious and they were like, what can we do to help? We just want to help this effort. So we're going to continue engagement with them, engagement with all of our partners. Like anything we do here is what makes something successful. So again, one day I look forward to sharing, Florida's figured it out. Here's everything perfect that we've done with our deck. It's not today. But the momentum and the support is there. So I look forward to you all continuing to support us in this journey. If we start to go left and we need to go right, keep us in check. Let us know. If we are missing some critical components that we haven't thought of, please let us know. So until I have that presentation where I share, we have everything perfect and beautiful and tied up with a bow, thank you for listening to where we are currently. So if you have any questions or any suggestions, I don't know if you have time on the agenda for that, but I'm happy to open that up. If not, I'll share my email address. I do not remember if it was put on the first slide. If not, that is my mistake. But my email address is Kelly, KELLY.Rogers, ROGERS @ethelhealth.gov, and I'll put it in the chat right now.
Thank you, Kelly. And I'll thank you so much for that and that update. If anyone has any questions, of course, you're more than welcome to come off mute. If you're sharing your story, we're asking, keep it around 3 minutes just so we can hear a couple of people. Share those stories or suggestions or questions that we have for Kelly. I'll tell you that I've been able to join a couple of those calls, and the excitement and the commitment of everyone that I hear speak is incredible. And it truly is a task, right, that they have been given. And I can't wait to see all the things that the RDAC is going to do, just to hear everyone on the call talk about just with such passion of trying to make a difference. It really is very, very encouraging, and makes us feel good, right? That all the work we have put into it at advocacy, from an advocacy standpoint, is creating these changes. Linda, you have a question.
Well, I'm going on the suggestion route, and I'm going to say hi to Kelly. I work for the Department of Health. I'm the statewide family leader for our Title V program. And I just want to throw out a couple of ideas. Number one, I hope that you all are perhaps going to have exhibitor presence at the Family Cafe, where you can start to gather data on those families who may want to acknowledge that they are a family member with someone with a rare condition, disease, disorder. And so that might be something for you all to think about if that's not already in the works. Number two, I am a part of the Family Center for Expecting Health and a part of their work group on DEI and B. And I'm just hopeful that that is integral to all of what you all are working on, that the diversity is in that considerations of all of the subcommittees as they work towards their goals. And there's a new paper out on this from the National Council on Disability that just came out last week on equity in healthcare for those with disabilities, that may be enlightening for you to reference. And then finally, Kelly, I hope you all connect with us at Title V, because we are serving that population.
Right.
And anyone with a rare condition almost always falls within the children and youth with special health care needs if they are still in their childhood to young adult years. And so we need to see if there's a way for us to support RDAC. I've been tasked with keeping up with what y'all are doing for Title V. So, but anyway, would love to connect.
I love that, Linda. Thank you for that. Exactly. Since we're the lead for Title V, or Title V grant in Florida, our partners right upstairs on the second floor, Johnny and her team, and I'm also a member of the Florida Family Leaders Network.
Yep.
I participated in their conference, and I've seen you present as well. It's so good to directly connect with you. We will have a presence at the Family Cafe. We'll have an exhibit table. So we're very excited. I would love the opportunity to meet with you and talk more about your other recommendations.
Okay.
And if you don't mind sending me that document that just came out last week, I would love it.
I will do so. And I'm so chagrined. I literally just got home from Tallahassee last night. I had a meeting with Johnny on Tuesday. So we just missed each other, but next time, right?
You got it.
Okay.
Thank you.
And I think Holly, please, I know you've raised your hands.
Hi,
Hi.
my name is Jeanette Acevedo. I'm from Orlando. I have scleroderma, fibromyalgia, and many other diseases, but as far as rare goes, scleroderma is it. I would like to see more information thrown out for scleroderma. Here in Orlando, we don't have very many rheumatologists that specialize in scleroderma. So I'm involved with many different groups. However, I myself need help. I'm going through a lot. And nowadays, for instance, like for disability and stuff, you need to be out of work in order to get disability. Well, guess what? I can't be out of work. You know, I have to work because I need my insurance and I'm not of age to be on Social Security. So that can be an issue, not just for me, but for many others that have rare disease, are working, you know, and really need to have not work, let's say a full schedule or what have you, but just, you know, ideas and try to get some other people to talk as far as our rare diseases and, you know, just support.
Thank you.
Thank you. This is great. I'm glad I was able to join. I was just looking through my emails and I found you guys. I'm like, oh, okay, let me join. But yeah, I would definitely like to, you know, get involved as much as I can. But definitely I need help.
Thank you, Jeanette. It's nice to meet you.
Likewise.
I'm from Orlando. I grew up in Orlando. So I consider that my hometown. So if you don't mind emailing me, I'd love to get more information and try to connect you to some support there. But one of the things that you mentioned is something that we've talked about in our RDAC is the need to almost GIS map where there are specialists that treat rare diseases and then we can see where those gaps are. We also want to process map the varying systems of care depending on factors like age and other factors. So there's like a map where people can see what all resources are available. So I think we, and I'm going to say we as like state systems, we have a lot of things in place. There's some things we don't have in place, but sometimes it's just really getting information out to that is the gap, and informing and educating. Oh, thank you, Linda. Educating people on what is available. But I'm fairly confident through our process mapping process and GIS mapping process that we're going to identify some gaps that we need to address, including where those specialists are. I mean, you would think Orlando is resource rich, but I think there's some assumptions that are just that.
Kelly,
Thank
you
you.
bring up a really great point. And Jeanette, I changed your name. I hope I spelled it right. If not, we'll fix it. You bring up a really great point. Something NORD has just started looking into is kind of a resource gathering components of, they've done a lot of restructure, something we didn't really cover just because it's not the focus of today's event, but we'll cover it in the future, is there's doing a lot of different initiatives for, you know, part of the change and hope to get things, you know, better in the lives of people affected by rare diseases is legislation is part of it. And your folks and Linda has a lot of great ideas from the Department of Health, but it's also education, advocacy, and those aren't legislative. I mean, you can't, you can't legislate people to advocate for themselves. That's an education piece. That's a learning process. That's, so there's a big component to all that, to change it. So I think you have a great idea. I'm not sure Kristen has read her email yet, but I asked to volunteer for that one. My other life, I do a lot of that kind of stuff. So it's really a big interest to me. So I have your email, which is now here in the chat, and I shall be contacting you, and definitely you, Linda, as well, because you always come in with these fiery ideas, and I love it. A woman after my own heart. I am definitely a connect the dots, get people what they need, liaison type of person. So I think you bring up a really great point. Stemming off of Jeanette's question, though, is telehealth is only one component of that. I'm not saying that's a replacement for being able to actually have specialists near you. Is the RDAC focusing? I didn't hear that, but maybe you said it, and I'm focused on a lot of different things. How is telehealth in the scene for coverage by insurance for some things?
There is Medicaid payment for telehealth services. The private insurance companies vary.
Thank you for your diplomatic answer, Kelly. Lovely.
When I
I
say
understand.
you really need someone on the council who represents private insurance companies, you really need them at the table. And there's even inconsistencies. I would even say in like Department of Health. So
Sure.
Right now we have a task force. I'm part of that task force to look at how we can identify some policies and some best practices for use of telehealth in our public health programs. So we've all learned so much from COVID, but as you all know, there wasn't the time and space to develop what those perimeters, those policies are.
Sure.
You were there, it was just you do it.
Yeah, you do it, but you don't want people abusing it. You don't want, you run into, that's a very complex issue. It's not as easy as just joining a Zoom or a.
It is. It hasn't been really discussed with RDOC. Not yet. Not yet, but it's definitely a factor that I'm surprised hasn't been brought up yet. So thank you for doing it.
Absolutely. Linda, I saw you had your hand up. Did you want to chime in?
Sure.
I was just typing it in, but probably a lot of you, or some of you may know, Family Voices had federal funding, and they put out some great information on telehealth for the family and patient side that's best practice based.
Thank you, Linda. We'll share that too.
So one other thing that actually brought to my mind that I forgot to include in our PowerPoint, and I was adding your email to the PowerPoint so people could see it on the screen. For those people who didn't catch it, it's tough sometimes to watch the thing scroll by. Is the report cards for every state have come out from NORD in this past week. Hint. Florida did terrible.
I saw.
And I'm gonna go ahead and post the link to the report cards if you want to see ours. If you didn't, I posted it on Facebook for everybody to see. We as a student of a report card, unfortunately, are falling behind. And I think this is an illustration of the power of what an RDAC can do, and some focus areas, include telehealth is one of them. And as you said, newborn screenings. I know we have a council for that, so that's great. I think that's a wonderful, and that's a very specialized component, which I think is great. We can handle that. But I think a lot of them, you talked about Medicaid and financial eligibility and that kind of stuff. I think that's a lot of that is wrapped up in, I think, what the RDAC can do. So there are some legislative changes that can happen in there. So most certainly, I shared another link in the chat if anybody wants to download. That's for the main page. You'll just need to select our state on the left side there, and then there's a PDF you can download. I wish you could say we do great, but it's tough. So it's a very complex issue. So,
You just connected the dots on what I mentioned initially, that we just, because of the timelines that were put in the legislation, we had to just jump into what does the statute say we have to report and our first report, and we need to just start focusing on that. Once that is done, ideally, we would have had a year before that first report was due, so we can look at what the real components of how states are graded and how we can improve to have supports for individuals with rare diseases. So we're excited to be able to dive into these. Once we get this first report done.
yeah, I wish there was some magic legislation that would cover it all, but unfortunately it's broken down into so many components, and some things need funding and some things need rules. And so I think this is a really great tool to break that down into the different components and tackle what you can. Some things are legislative, and some things I think you could pass along to the Department of Health as an educational piece, sort of, as how you dictate certain things. I realize Department of Health is huge and it has a bunch of components, but I think that report card is a great focal tool for that. And I understand, I actually work in a capacity that handles that kind of stuff. So I deeply understand where you are and how difficult that can be. So I think this is a really great opportunity for the RDAC to tackle that. And that's what we established. I think that's why we got it together. Again, that was House Representative, Florida House Representative DeBose and Dennis Baxley from the Senate, who were the original sponsors for the RDAC bill. We thank them so much, because, we got to have the gratitude for them, because they are big champions of people with rare disorders, and they really care about it. So I'm going to actually put our contact information up on the screen. And does anybody else have any other questions? Comments are fine too, or other things.
Well, you all know how to connect with us. Please follow us on social media. And as we kind of ramp up to actual Rare Disease Day on Monday, I mean, let's go and spread the word and talk to people. Wear your stripes this weekend. Let's post on our site, share with us on Facebook, because I think the more we can share with the group around us, I've always said it, we can impact those that are in our circle to continue to spread the word about what needs to be done, what is being done, where do the gaps exist. The more people that know, the more change we can have access to, or create those ripples as we go through. So I'd encourage everyone on your personal pages, tag us, Rare Disease Day, show your stripes on all social media platforms. Because I think that this is part of what causes the change to happen. So thank you everyone for joining us. Needless to say, Kelly, thank you so much for taking time to join us today and share with us what the RDAC is doing. We look forward, of course, to having you back when that report is done, and really looking forward to all the great things that the RDAC will do for us.
I have a quick question.
Yes, of course.
So when they announced Rare Disease Day on Monday, are we going to be able to watch it live somewhere?
Yes, you will be able to register. Fran, can we include the link for the registration? And
she's talking about Senator Baxley, I think. Yes,
Senator Baxley.
From what we were told, Kristen, I'm sorry if you have anything updated. I've looked everywhere I couldn't find any updates. I was feverishly looking to find if they, because they post stuff a lot. I have not found any information, but we're supposed to be able to watch it on one of the live. A lot of times you'll go to the page where the bill is. They'll have like a watch now as they read it type of thing. I posted the link to the bill further up in the chat. I will pull it back down one more time for y'all.
And we certainly will be looking throughout, like later today, to see if there's any times that are posted, and we'll post a link on there. I know typically there's the Florida Senate live view that comes on. We'll post that on our Facebook page as well, and Twitter. So we'll make sure we have the link for y'all as we get it as well.
Great, great.
Hopefully it won't be during the Nord event.
All right.
Exactly.
Double screen things. And I will say, Kelly, one other thing, and I meant to mention this earlier, part of the reason I was in Tallahassee is every year during session, Disability Rights Florida, which is our P&A organization. I'm on their board of directors, and as is Dr. Jeff Brosco now. He's brand new to the board, if you know his name.
Oh,
And
I've worked with Dr. Brosco.
that's what I thought. I figured probably so. So he just does. So I mentioned to them and staff about our new RDAC, and that there might be some nice synergy there as well, because they are in the world of advocacy as well as protection for those with disabilities. And again, those with rare conditions would fall under that realm. So if it's all right with you, I will send an email introducing you to the staff there.
Yes, that would be great. Linda, you are awesome about just connecting dots. Thank you.
Yes.
I love doing connections and networking, and I've been around a long time. So Johnny can say, yeah.
Yes, love it, love it.
So Linda, you said you're on, oh, I'm sorry.
Go ahead.
You're
Go
on the
ahead.
board of Disability Rights Florida?
Yes, board of directors.
Well, I can't say enough wonderful things about Disability Rights Florida, because my son is 16 years old now, but he was diagnosed with eosinophilic esophagitis when he was 6. He needed a G-tube and a feeding machine. He was in elementary school, and the elementary school was just so, I can't even use the words.
I
They
understand.
weren't allowing him to have his feeding machine changed and refilled during the school day. They told him to go to the bathroom and do it in the bathroom. And I said, would you eat your lunch in the bathroom? That's just not appropriate. And I contacted Disability Rights Florida. They sent an attorney, and in the meeting, there were like 20 people from the Palm Beach County School District, and me, my husband, my son, and our Disability Rights Florida attorney. And so we ended up getting things going our way. And I was just so miffed at the school that we left that school after the year was over.
Well, and thank you for sharing that. And again, that's part of what RDAC is now going to be involved in, is all, I mean, not in that direct kind of way, but that they have the heart of advocacy for families like ours. My son has had a G-tube and a trach all his life, and we know that conversation with school districts. We certainly understand that. So I'm glad that it resolved well for you all.
Yeah,
And
is Felicia
also-
Jordan still there? Felicia Jordan?
Yes, she is.
She's the one that helped us. She was fabulous.
And I'll just even piggyback on that. We contacted them and worked with them when Clayton was going into kindergarten. Our school district felt very strong that the words they used was that Clayton needed to be in a school where he can learn life skills, because he was not able to, from their perspective, participate in a regular school setting. And so we contacted Disability Rights, and I can't even remember how many hours of IEP meetings we had that summer. But we were successful, and I'll just share that Clayton is now 28, and he lives in a beautiful apartment in Jacksonville, where he works as a civil engineer in a private civil engineering firm. So, you know, us advocates, you know what's right. And
That's right.
to get it there.
That's why Jahani and Fran, they are advocates bar none. Their hard work for years has brought this to fruition, and I applaud those two women sitting with us right now. So that is why we are all here having this conversation today. So blessings and bravo to both of you. Thank you.
Thank you. Thank you so much, Linda. Always great. But please reach out to us, connect with us, any questions, ideas, get them to us because we can definitely bubble them up, get Nord to help us or connect in our state and connect with each other. So thank you everyone so much for joining us today. We look forward to the stories and the zebras and everything that you'll tag us on this weekend. Hope everyone has a fantastic Friday and look forward to seeing everyone again soon. Bye. Thank you, Kelly. Bye.
Thank you.
All right, I put Jeanette back in the waiting room.
Are you still recording?
Yes, I am not anymore.